health sisters have access to the system. They can see when the appointments are scheduled. And so once we have gone through that backlog of people who we have on the list, then at some point in time we'll be opening up to different categories. But at present, we're doing the backlog with people, which include 70 years and over, 18 to 69 with chronic NCDs. We've also got some people from national security, from the teaching system, frontline workers, people like that have been done. And once we have got those completed, I think we have enough 10,000 of those to finish. Once we finish that group, that should take us to the end of next week. And then we will start the second doses on the 17th of April for going forward.
You mentioned teachers. Are there specific areas that they are going to, or is it just like this school and anything?
There are a number of locations they're going to. What the Ministry of Education, they had a form where they booked through the Ministry of Education. So the Ministry of Education allowed the teachers to select the areas they're close to, and they send us that information. We enter into our appointment system.
And at the beginning, you had mentioned that there was a bit of a delay here. I'm not sure if you can explain that on direct.
Yeah, there was a short delay, but that's actually in progress. Remember, we're using technology, and sometimes the technology doesn't necessarily always cooperate. So sometimes we may have a short delay. But once it gets working, it's going, because we're linking into 3 different databases, which are secure data, and we're using a lot of uploading into the internet. So we have to make sure that everything's secure before we're up and running.
And then one last question, if you could remind me the overall figure, or maybe an estimate as to where we are at.
Well,
the last one, sorry.
We were just under 64,000. By today, we'll be well over 65,000, probably closer to 60. Sorry, we'll be well over 64,000, closer to 65,000 or more. Yeah.
And then the backlog itself, how many persons?
Well, originally the list we had about 10,000, so that's going to slowly come down. One of the issues is that when we call up some people as well, we realize that they have also gone or received it without waiting for their appointment. So there are a lot of people who just went and showed up. But if people have waited, we'll be moving through the system one at a time.